Project ECHO at the University of New Mexico, and it's our pleasure to welcome you. My pleasure to be the first person to welcome you today to this session of the COVID-19 Vaccination Building Global Capacity Learning Series, focused today on generating acceptance and demand for COVID-19 vaccines. Next slide. Just a few housekeeping items. The first is that interpretation is available today in French and Spanish, and you can access those by going down to the bottom right of your Zoom toolbar and clicking the globe icon, and you will see French and Spanish available. Next slide. Also, just so you're aware, if you want to mute the English, you can click the mute original audio, and that will help you hear more clearly the interpretation. Next slide. We really welcome your questions and comments on today's session on the topic today. Please put those in the Q&A session, and our expert panelists will be monitoring that and answering as many of those as we're able to get to today. Also, if you have any IT or logistic issues or questions about the certificate of attendance, please put those in the chat, also down along the Zoom toolbar. And look in the chat, there'll be a lot of links to resources shared with you today. Next slide. We are recording today's session as we are for all of this series, and your attendance is consent to be recorded. The recordings will be shared after the session in English, French, and Spanish within a couple of days on a website just for this series, and we'll share a link to that in the chat in a few moments. A certificate of attendance will be available through the University of New Mexico via a link in the chat at the end of the session, about 15 minutes before the end. We really welcome your feedback on how these sessions are going and how we can improve them. So please take the survey that will then link directly to an instant certificate of attendance. Next slide. Just a note about data use. We take data stewardship very seriously. Your individual data will be all de-identified and kept confidential. Next slide. Just a reminder that this series of programs is built on the open WHO trainings, one focused on national deployment and vaccination planning, another on training for health workers. We'll share links in the chat for those and encourage you to take advantage of that great resource. And these are complementary to that. Next slide. With that, it's my pleasure to pass the microphone over to Shoshana Golden at WHO. Shoshana.
Wonderful. Thank you so much, Bruce, and welcome to everyone who's joining today's call. Next slide, please. I'll start off with a few announcements. The first is that the COVID-19 Vaccine Introduction Toolkit is now available in all UN languages: Arabic, Chinese, English, French, Russian, and Spanish. The links to this Vaccine Introduction Toolkit will be posted in the chat for your ease of reference. In addition, short instructional videos on how to handle, prepare, and administer the AstraZeneca and the Moderna COVID-19 vaccines, and how to identify anaphylaxis are being added to the COVID-19 vaccine specific course very shortly. Next slide, please. I'm now showing a very useful slide. Many of you have been asking in past sessions about some of the key information for the various different COVID-19 vaccine products. What you have here is the key information summarized for each of the products that the SAGE has already provided interim recommendations for. So please feel free to use and to share this resource out accordingly. Next slide, please. Today, we will be talking about acceptance and demand for COVID-19 vaccines. We'll start off with a presentation on demand planning, some tips and tricks, an overview of how to use data to inform planning. We'll then cover key elements of community engagement followed by a country case study looking at India's experience. As always, we'll conclude with our what's next, how you can access the recordings and the upcoming session topics, and our question and answer. Please feel free to be adding your questions through the Q&A feature throughout the call. Any unanswered questions that are relevant to the topic will be covered by our experts in written format after the session. Next slide, please. Today, our goal is to provide an overview of the key information and resources that can help countries to generate acceptance and demand for COVID-19 vaccines. We have two learning objectives. The first is to explain the key aspects of demand planning and how data can inform this planning. The second is to provide an overview of how to engage communities to increase uptake of COVID-19 vaccination. Next slide, please. I'll now turn it over to Deepa, who will be walking us through demand planning tips and tricks. Over to you, Deepa.
Thank you, Shoshana. Good morning, good afternoon, good evening, wherever you are in all parts of the world. My name is Deepa Pokhran, and I am the C4D specialist who works with immunization team health section with UNICEF New York. Next slide, please. As Shoshana mentioned, one of the purpose of today's session is to share with you what have been the resources that the global team has been working at global level in partnership with many organizations. For demand planning, we've got a narrative guidance as well as a planning template which countries can easily adapt and use. There are some basic messaging that we've developed, which we keep sharing. There are some training resources as well as the training module on NDVP and health workers training that we've developed. On the data side, we've developed the survey tools, both qualitative and quantitative, as well as user guidance, which can be easily looked at and people will be able to understand what are the key tips for collecting, analyzing, as well as using data. And then on the service experience part, we've got a health worker training model, which is available in WHO Open Site. We've also developed some health worker job aids. And then there are community engagement guide, which has been built onto the RCC work that was being done by different partners. And last but not the least, there are some things on social listening that we've developed, the misinformation field guide, which is available in French, Spanish, as well as English. Next slide, please. So I'll just ask colleagues before we start, just to make it more interactive, if we could run a poll. I'll ask colleagues to just consider what would be the things that you would consider when you are doing a demand planning interventions as you are preparing to roll out the COVID-19 vaccine. This is a multiple choice. So if you could just take a few seconds to just tick on it. I think the poll has been run by colleagues here, and just tick as many as you think are going to be relevant for demand generation interventions.
Deepa, you can please continue with your presentation while we wait for our participants to fill.
Let's look at the poll. I think we should have a pretty good idea by now, and then I'll continue. Okay, great, wonderful. Okay, so if everybody can see the polls, you see that there's been quite a number of things which has been entered, and then the highest one is community engagement, which is excellent. Usually community engagement is something which is not picked by colleagues. Media management is another thing that colleagues have said, and then the third part is the advocacy capacity. So everybody has actually picked up one thing or the other, But this gives us an understanding that we need to actually really focus on all these areas. Actually, no, it's not really one is less important than others, but we get a clear understanding that we need to emphasize and focus a little bit more on social listening, as well as with the other things. So the next one, next slide, please. You can get close. Yeah, next slide. So I'll just go through a couple of tips that we can pay attention to while we are doing demand planning, keeping in mind that all the things that we ran the poll on, for example, we start with social listening and then we go into data. We plan to do community engagement. We also have to build capacity of national as well as subnational stakeholders, as well as at the community level. And then, of course, the implementation of the products that we would have developed and the key messaging and products. And then we go on to see whether these activities that we have done at the community level are making a difference or not, including the media engagement. One very important thing I would really like to emphasize is that the crisis communication is going to be very, very important. So just some key tips. So stakeholder support is going to be very important for us at the national level, as well as all levels, subnational as well as community level. The reason is because everybody is affected by COVID vaccine, and it is not just a response from health. It has to be a joint initiative from all stakeholders of the society. Of course, we need to identify who are going to be the priorities. For example, this time when we are introducing the vaccine, it's not just for children, it's actually for adults as well as health workers and people with comorbidity. So who would be these people who would be able to access the communities is going to be very important for us to actually understand. That's why the second point then on local data becomes so important. We need to actually be aware about what is going on in terms of communities' perceptions, understanding, and knowledge. So if as much as possible to do a quantitative as well as qualitative data. Lisa will be talking a bit more in detail about what are the tools available to us and how we could do a quick rapid survey to inform our communication planning and also use the data. Then the third thing is what kind of behavioral strategies do we use? And it's not going to be one strategy is going to be workable for everybody. So just to look at a broad range of interventions, but also the communication channels that are available at different levels will have to be considered when we are trying to inform our behavioral strategies, which would need to be a combination of mass media, interpersonal communication, as well as the social media. And then we have to make sure that the certain specific messages are being tailored to reach out to different audiences. The fourth point is then how do we make sure that the communities are at the center of everything we do? Most of the time when we are planning our communication response, we tend to think of mass media, which is quite easy, very important also, but more and more it's very important to listen to communities, what their concerns are. And as you know, with this COVID vaccine, there are lots of rumors, misinformation going on. So it's going to be very important to listen to what the communities are saying and then tailor the messages and our approaches accordingly. Engage with them from the micro planning level in implementation, as well as when we are monitoring and doing community surveillance. The fifth part as a tip is not to forget the capacity and system strengthening. And when we talk about capacity, we are not just talking about health workers. Health workers are a very important part, of course, but we are also looking at the CSOs, the partners who are supporting the COVID-19 vaccines, the communities, the social mobilizers, the vaccinators. There is a community engagement, vaccine demand component in every level of the work that we do as we roll out the COVID-19 vaccine. And then lastly, also very important to integrate with broader plans, because as countries prepare their planning for rolling out, or they are already rolling out the COVID-19 vaccine, it will be important that demand does not just stay as a standalone intervention, because it has to be integrated into everything we do, particularly when you think of the crisis communication. Usually we tend to think of the forms, the medicines, and how to be ready, but there is a very important role that the communication plays in the crisis communication. So that has to be integrated into the crisis communication as well as the overall plan when we are planning to do the COVID-19 vaccine rollout. Next slide. So these are some of the global resources that I already talked about as I started my presentation. There are links to everything that has been developed. You will find these in WHO open site in vaccine acceptance and demand page. You will also be able to find the link and you'll be able to find the resources in the demand hub, which is a global coordination mechanism where partners have all gathered together to develop all these tools. So you'll find that in the link in the Demand Hub web as well. And all these links, including the NDVP training modules, the messages are available. Some of them, as you will see, the advocacy messages does not have a link, but there are resources which we can share as countries roll out the COVID-19 vaccine, particularly on the demand side. So I'll hand over to Lisa with that.
Thanks so much, Deepa, for that introduction and for setting the scene here. So in the next few slides, I'm just going to outline the tools that are available to support us to be gathering and using the full range of social and behavioural data so that we're equipped with the right knowledge about the reasons that will drive vaccination and to be able to use that for the design and evaluation of locally tailored interventions. And so why are we doing this? On the next slide, I just outline a few key points about why it's really important for us to be measuring these behavioural and social drivers of vaccination. So it's really about ensuring that we have the right knowledge from the local context that enables us to tailor these local interventions. And we know that the reasons for under-vaccination or the factors that will drive vaccination are often so context-specific. So having this knowledge that we gather through both qualitative and quantitative measures is absolutely critical. And we then need to be using this data together with all other sorts of program information, surveillance data, coverage data, other information that might be about a supply of vaccines. And we combine all of this data normally to then be able to look at where and we tailor certain types of interventions. And Deepa took us through a range of those different types just a moment ago. This data is important to be used at a local level, in countries at a national level or subnational level, maybe in specific districts or specific communities. And that data can be used not only to inform the design and tailoring of local strategies, but also later on for tracking of trends and later adjustments to those strategies as well. So that as the situation evolves, we're able to make certain changes to the work that we're doing to respond better to the current environment. And importantly, this data will also be reported back up to global partners as well through different kinds of reporting mechanisms, perhaps only for certain key measures or key indicators, core indicators, and that will enable us to have a broad view, and that's a view that's comparable between different countries to also understand what are the main drivers of vaccination uptake or what's becoming a barrier, so that we're also able to better help partners and regions and countries and everyone around the world to be able to close these gaps in vaccination uptake. So on the next slide, what are these drivers and how do they contribute to vaccination as a behaviour, as an outcome? So through the work of a global expert group that WHO and partners have established, we have looked at the global evidence over the last few months, and based on the evidence, we have developed this framework to outline the 4 main domains or themes that shape vaccination uptake. And these main factors are what people think and feel. And this is where we situate attitudes or confidence or beliefs related to vaccination. This is also where we situate whether someone's been exposed to negative information about vaccines. Secondly, we then have the social processes, the social influences, social norms, and other factors that happen at a local level. And this is what we try to act on when we're thinking about community engagement or other types of work with local champions, for example. And these factors typically shape motivations or intentions, excuse me, to get the COVID vaccine or normally any other vaccine. On the part of the health worker, this is also about their recommendation or willingness to recommend a COVID vaccine. So whether they really feel comfortable about wanting to recommend a vaccine to the community that they work in. And these factors are then normally influenced by practical factors or logistical factors, which is really about these factors on the supply side or service side related to the ease and convenience of services. So the convenience of getting to those services, the experience of what actually happens when they're being vaccinated, and even what happens just afterwards in relation to the experience of some of those mild or moderate side effects, which we know will be potentially experienced related to COVID vaccines, a mild fever, a little pain in the arm, things like that. So this framework is used as a basis for the development of our or interview guides that will contribute to enabling us to generate the data that we use to inform the design of our strategies. So on the next slide, just to provide an outline of the tools and guidance that are available, and we've developed these at a general global level, that they can be adapted to a degree at a local level, depending on the local cultural or other contextual considerations that can be unique in specific settings. So normally for childhood vaccination, we've got a set of tools related that are a survey, a quantitative tool, but also interview guides targeted to caregivers, health providers, health workers, community stakeholders, authorities. And then we have some implementation guidance to go around it, which is the how-to of how to gather and analyze the data and how to use that for your planning. And similarly, we have a similar corresponding package for COVID vaccines, where we have the quantitative tools that are targeted to health workers and adults, in-depth interview guides for interviews and focus groups, for example, and then the implementation guidance too. And both of these sets of tools are built on the same set of domains that I just presented on the previous slide. So over time, as programs start using this package of tools, they'll also be able to compare certain factors that could be important to know about, whether it's about the community influences or other types of factors that are important. On the next slide, just outlining how the data is then used through a framework for looking at what interventions can be implemented and how they're going to be measured. So for example, one of the indicators that we have in the tools are about the number of adults or health workers who know where to get vaccines for themselves. So this is about practical knowledge about the point of contact and their engagement with services. So the interventions here can be about improving access to vaccination, offering reminders about appointments, carrying out further outreach, things like this. And here's ways that they can be further assessed or implemented through messages, other mechanisms that help to connect people to the services, and then also the outcomes that can be measured related to the outputs and interventions and the original indicator. So this is how each of our main domains and factors can be acted on from an implementation standpoint and then measured accordingly. And just on the last slide, a quick overview of what we're going to be doing to support implementation of all of these tools. So in addition to building knowledge and awareness of what these tools are and how they can be used, we're planning on putting some implementation support around them to help people to use them, that they will have the skills and experience to be able to do that. So there'll be a community of practice platform that goes around it and helps people, and where we can exchange learnings and experiences of how these tools are used. And we'll also be looking to track this data as well. So making it available in a global repository so that we can all look at what we're finding and the different kinds of trends, and that we are seeing these different experiences and lessons as what's happening and what actually works in terms of the interventions and what we're learning from even the methods and the instruments themselves. So this is a program that we're building around the tools right now, and stay tuned for more information on this in future. Thank you very, very much. And back to you, Shoshana.
Wonderful. Thank you so much, Lisa. Next slide, please. We will now go to Tamar to talk to us about community readiness and community engagement.
Hi, my name is Tamara Zalk, and I support the WHO and the Risk Communication and Community Engagement Collective Service to develop a range of community engagement tools, guidance, and principles to help support COVID-19 response. Next slide, please. One of the ways that the WHO is supporting countries strengthen their engagement and empowerment strategies is through the creation and rollout of the 10 steps to community readiness. What countries should do to prepare communities for a COVID-19 vaccine treatment or new test. The 10 steps to community readiness was developed by the WHO, UNICEF, IFRC, and the GORE network through the RCCE Collective Service. The Collective Service is a new partnership launched in June 2020 to strengthen the coordination and quality of practice for the COVID-19 pandemic response. As vaccines and other biomedical tools become more widely available, building trust and engaging communities remains essential. We have learned from previous epidemic responses that communities, when they are fully engaged and actively participating in the full cycle of planning, delivery, and assessment for new biomedical tools, demand for these tools increases and leads to widespread and effective uptake and use. Next slide, please. So why are these so important? I mean, despite the importance around demand uptake of these tools, many countries have not prepared sufficiently, and their communication strategies and plans do not often reflect the application of the tools that are ready to be introduced. The evolving nature of the virus has resulted in an often confusing communication ecosystem. You may have heard the term infodemic, which describes the overabundance of information, including misinformation and rumors, which makes it hard to know where to go and who to trust for information. To complicate things further, coordination with countries through numerous global and regional working groups can be fragmented and confusing. And the arrival of new biomedical tools means dozens of more of new partnerships and stakeholders, each with their own different communication needs and priorities. On top of this, people have real concerns, valid concerns, over the safety of vaccines and other biomedical tools made with unprecedented speed and with new technologies. These concerns must be acknowledged and addressed by providing individuals and communities with actionable, timely, and credible health information from trusted sources, and by providing the space and follow-up necessary to work through the concerns with trusted health or community leaders. Past epidemics have shown us just how quickly and widely individual or community fears can spread if not dealt with in a timely and comprehensive way. And lastly, despite efforts by the WHO and many of our partners, investments in community engagement and empowerment strategies are not sufficient to ensure equitable rollout and the maintenance of trust. It was exciting, however, to see in this group of people, so many people acknowledge the importance of community engagement. Next slide, please. So as we all know, what's at stake is quite a lot. Millions of people have lost their lives and many more will lose theirs if we do not act swiftly and efficiently. If we're not prepared, the rollout of biomedical solutions will be ill-adapted to local contexts and realities and lead to suboptimal and often inequitable uptake of COVID-19 vaccines, treatments, and tests. Billions of dollars worth of investment in new biomedical tools could be wasted, and the pandemic may continue with precious opportunity to end or control it missed. Next slide, please. So many of the steps that you see here have been referenced by Deepa when she was sharing her tips and tricks, and certainly are very much a core part of the work that Lisa is doing as well in the multitude of tools and materials and capacity building modules that have been developed. The 10 steps to readiness is really built around the recognition that the empowerment of people and communities is not an abstract idea, and that there are concrete and measurable steps that can be taken to ensure citizens are engaged and ready to support new biomedical tools. Though communications needs may be slightly different for each step, and of course across countries and contexts, the principles that promote their safe and successful introduction are the same. And the steps build on well-established RCCE principles, ones that we've seen before and that we've often used ourselves. They put communities at the heart of the rollout and promote trust, which is really, as we all know, the critical ingredient for all community action. The 10 steps you see here are accompanied by a set of vetted guidance tools. Vetted guidance tools and trainings, which you can find on the Collective Service website. I will share that with all of you in the chat. Each step is broken down into concrete action and links the most update related resources. So for instance, you see step 1 is make decisions about the people with the people. And so as part of the Collective Service resources that accompany this 10 steps guide, you would then click on the 10 steps, see some actionable ways of utilizing it, and then it would link you to a number of different guides pertaining to general RCCE resources, vaccine resources, treatment resources, and testing resources. We really believe that it is essential that we invest in this kind of coordinated and proactive community engagement approach, and that these approaches not only support the widest possible uptake of new tools, but also support the continued maintenance of protective behaviors.
Development section at UNICEF India. I'm just going to give a very quick brief of our experience so far with specifically with vaccination. Next slide, please. Next slide. Okay, so what did we do with COVID vaccine communication? There are 4 key lessons we took from 2020 from our COVID response, particularly along capacity development, which Deepa and Lisa also talked about. Second most important thing is around behavioral insights, or BEST, which was presented earlier. The third very important piece was partnerships. One agency or a few agencies cannot do it alone. You need a number of agencies across the geographies to make sure risk communication and community engagement happens. The other one, which we normally tend to forget while trying to implement risk communication, is the gender and equity lens, which is absolutely important, because if we do not have that, the marginalized populations can definitely be missed, and also from a gender perspective. Next, please. And of course, while we are promoting the COVID vaccine, we should also be cognizant of the fact that we need to even intensify uh, the three key behaviors which we call in India as the COVID appropriate behaviors. Next. So we in India also, we meaning a number of partners under the leadership of the Ministry of Health, we have invested quite a lot in evidence, behavioral insights and studies to inform our communication programming. So this just gives you an overview of qualitative and quantitative. One important piece I would like to mention here is last year during the response we were not being able to do a lot of face-to-face studies or face-to-face getting insights from the community, but we started doing it in the last quarter of 2020 because that is absolutely important, the qualitative aspect of it, because we feel that and we know that getting insights particularly on perceptions was quite difficult from online surveys. That is why we had an equal emphasis on both qualitative and quantitative studies to inform our programming. Next, please. Next. Okay, so what did we do? We supported all the partners, including WHO in India, supported the Ministry of Health in developing an evidence-based COVID vaccine communication strategy, which is available in the website, as well as all the other UNICEF sites and the Ministry of Health sites. There are 4 blocks to this based on our evidence that we had gathered so far. We are focusing on 4 pillars. Number 1 being we do need to communicate on the correct information on COVID-19 vaccine. Of course, you might be asking that there are various brands. So we are trying to, in this case, we're trying to be as brand agnostic or product agnostic as possible and giving information related to the vaccine, particularly relating to the priority groups, meaning 60 plus, 45 to 59, as well as the health workers and essential workers which came in first. The most important one, which I will come to in the following slides, is the constant juggle we are facing currently with vaccine hesitancy as well as the balance with vaccine eagerness. I will explain why I come to that in a short while. And I already mentioned the 4th pillar being the constant promotion of promoting COVID appropriate behaviors. Next, please. Those are the 4 pillars. So what do we need to do? What are the strategies we need to implement? Those 4 pillars are, for us, the 5 strategies: advocacy, capacity building, media engagement and social media, definitely, social mobilization and community engagement, which we have, I think, which my colleagues before have also explained in detail. And last but not the least, absolutely important, is the AEFI crisis communication. So all of these 5 strategies, we have started using it again to build a lot of confidence among the target population. Next, please. So I'm just going to go through a few slides on what we have done. We've used that 5 strategies across the board. So if you look at pictures on the top of the screen, top right hand of the screen, that's the Chief Minister of Telangana, where where we are actually involving the highest levels of states in the communication planning. So they're not only involved in the programs, but also in guiding us what communication needs to be done. As you know, India is almost like a continent with a number of languages. So one size does not fit all. So we need to go with separate, even tailor-made strategies according to the states. What you see here is also a few materials which we have supported the Ministry of Health in rolling out across India in 11 regional languages and 16 regional dialects. Next, please. One of the key highlights here, sorry, it's in white font, but one of the key highlights here, and was a request from the Ministry of Health as well as the National NECVAC, which is the group, the steering committee, which is guiding the entire COVID vaccination, was an ask or a request to establish a national media rapid response room, which has been running for the last 3.5 to 4 months, supported by UNICEF and the Gates Foundation, where we have a team of 15 people, 7 of them monitoring 24/7 what is happening in the social media world, Twitter, Instagram, across the board, Facebook, and across the board. And then we also have 7 people monitoring all the online dailies, as well as print, electronic, and television. Now, what this is doing is actually helping us real time to also tackle misinformation, trying to see where the rumors are coming from and how to tackle it effectively, and also informing the states along the lines. Next, please. So, talking about hesitancy, and these some of the points here are more around, which have been now catered to as we move along. So, just some few points. Of course, in the research, there has been a huge low risk perception, even though there is a spike in case right now. The formative research across the states are showing so. There was also some hesitancy among medical professionals right at that point of time, which is of course gradually decreasing. The other one is not everywhere, but in some pockets, the religious and the faith-based organizations were not actually for the vaccine, and that's something which has been carrying on since routine immunization days, and those are some techniques which we try to use in order to abate that. There was also on the lack of clarity, and finally on the vaccine having traces of various materials. So these were some of the areas which we got from constant behavioral insights on why hesitancy is taking place. Next, please. So what approaches are we currently using to address vaccine hesitancy? Like I said, apart from the 24/7 national media response room, we also have a rigorous social listening analysis done by a number of partners, including WHO and UNICEF is working together for both offsite and online social listening. The other most important is to use a host of credible influencers, be it doctors, be it celebrities, be it community doctors, as well as health workers from each and every state, district, and block level, so that people are less hesitant. The other one is, of course, mapping traditionally known vaccine hesitant and resistance areas. And this is something which we have been doing over a number of years, right from the polio eradication program to the MR vaccine campaign, which we had done. Next, please. In terms of eagerness, there is, of course, currently at this point of time, it's been 3 weeks since it is opened up for everybody over 60 years old and between 45 and 59 years old with specific comorbidities. So currently there has been less hesitancy and more eagerness. And that's where, we are constantly having to change our strategies as we move along. So these are some of the ideas in terms of sharing transparent information, having a rationale for why there are priority groups, because some teachers are saying, the Teachers Association are saying they need to be vaccinated first, but I'm going to come to that a little bit later, because tonight there's going to be another news in terms of the opening it up for the 4th group. Next. So some challenges and opportunities, I would say, in both aspects, because I was mentioning that it is an extremely dynamic context we are in. While we are working on hesitancy in some pockets of India, some places there is a huge awareness, eagerness among the population to put the vaccine. So we need to have, again, tailor-made strategies and have all materials and strategies in place for both these areas, coupled with a constant intensification of promotion of COVID appropriate behaviors. Adaptations of strategies, like I said, needs to be tailor-made, and that is something which we are currently also constantly trying to improve upon. Monitoring is an area where we are again trying to be much more forthcoming in that, because we're not getting that monitoring information across the states. Of course, improvement is there about 70%, but we are still trying to strengthen that. The Ministry of Health is not the only ministry which needs to be engaged in this. So we are trying to work across all the ministries, meaning the line departments, in terms of using their platforms also for vaccine promotion. Next, please. So yeah, that's it from me. Just wanted to say that we will be getting news tonight, probably by the ministry, that the vaccination might be opening up for everybody over 45 years old. So we'll have to wait and watch and see whether we employ the vaccine eagerness intervention or the vaccine hesitancy intervention. It's for us to see, and we are happy to share all the documents and links of our experience so far. Thank you very much.
Wonderful. Thank you so much, Sid, for that fantastic presentation. I'll briefly talk through what's next, and then we'll go to our questions and answers. Next slide, please. As always, recordings from the session will be available in English, French, and Spanish. Recordings and the presentation will be shared with all participants after the call. To continue the conversation, please ask your questions either in the Q&A feature and/or share your experiences through TechNet and Telegram. The links will be posted in the chat. Our next two topics will focus on reporting on COVID-19 vaccines on the 30th of March, and that's intended for our health workers. On 6th April, we will be talking about vaccination strategies for COVID-19 vaccine uptake. Next slide, please. We will now go over to the question and answer portion of our session. Any questions that are relevant to the topic that are not answered during this session will be shared with our presenters, and they'll respond in written form. For our presenters, we have 3 questions that stood out as really useful for you guys to provide a verbal response to. The first one is, for countries like my home, where the population has lost confidence in the government because there have been challenges with the communication, how can they communicate effectively so that communities adhere to the vaccine? Panelists who would like to respond, please unmute yourself, turn on your video, and respond accordingly. And I would suggest that we start with Tamar, as there seems to be a strong community engagement piece to this question. Tamar, can you unmute yourself? Okay, I think we may be having some technical issues. I'll turn over instead to Lisa. Lisa, can you please unmute yourself and respond to this question?
Thanks, Deepa. Sorry, thanks, Shoshana. Could you reiterate that question and just kind of reframe it, perhaps? Thank you.
Absolutely. So the question is, where there's been challenges previously with communication and the population has lost confidence in the government, how can governments communicate effectively so that communities are responsive?
Yeah, very good question. Thanks, Shoshana, and thanks to the person who asked this. So where trust is lost, it's important to start by listening and to really understand what has actually been lost in this process. So there are many ways in which trust can be lost, and it's lost very quickly too, if that's the case. And sometimes it can be eroded in relation to the vaccines or in relation to the health systems and services, or aspects of the decision-making and regulatory process that was about how the country decided to introduce this particular vaccine. So through that listening process, the concerns and questions of communities can be better understood, and then they can be responded to in a specific targeted way. And as part of the communications response, once those concerns and issues have been understood, those communications should be relayed through trusted spokespeople and trusted community members and others who are really closely connected to the communities that they serve. So in some cases, those communications could be relayed through health workers or other traditional leaders or community leaders, religious leaders. It's going to be very context specific, but it's really important to think about the wide array of people who will be trusted in such a setting, as they will have a greater likelihood of those messaging and the content there being more impactful. That's a short answer.
Thank you so much, Lisa. I'll now ask two questions together, as I think that they may be interrelated. The first question is, according to studies, vaccine hesitancy ranges from 20 to 30%. What are some of the reasons for this, and how can we address them? And the second question is, how do we handle COVID-19 vaccination being politicized?
I can take that too, Shoshana. So for hesitancy, so to begin with, it similarly starts by understanding why people might be hesitant and why they might have these questions and concerns. And also with the rollout of a new vaccine, it's not unexpected that we will see that there are certain population groups that are going to be a little bit undecided or want to have more information to contribute to their eventual decision. So this might take a little bit of time for people to be able to see the smooth rollout of the vaccine and to see their friends and family and others that they trust deciding to accept the vaccine. So it's really important to start by listening, to understand the questions and concerns that people have, and also just to note that it is going to be normal for there to be a population group that will take slightly longer to make that decision to accept the vaccine. And so once we've understood exactly what the issues are, we're then able to respond in a tailored and targeted way. And sometimes there will be a range of different strategies, multiple different ways in which we're able to address the hesitancy. And it could be through communications, it could be through community engagement, it could be work with our health systems and health services, because we know in many cases, health workers themselves have been the prioritized population for COVID vaccines. So think about the full range of strategies that would also be required to address any possible hesitancy or all those questions. And then in a situation where COVID vaccines has become politicized, this is tricky and complicated, and we are seeing this in different settings. And I think that we also then need to make sure that we're working through people who are not politically affiliated in a certain way, if that's possible. So we need to carry out a mapping of people, champions, influencers, stakeholders, partners, many others, civil society organizations, networks, and networks in the aging sector or youth sector, women's networks. So carry out a mapping of all of the different possible groups who could be really supportive in terms of vaccination and help to avoid any kind of political affiliation or any other kind of influence that's not scientific and that's not about promoting the benefits and importance of vaccination, together with the other kinds of strategies and behavioral interventions that are still really important as we're rolling out COVID vaccines. So all these other preventive behaviors like wearing masks and the distancing and everything else. So these things really need to go together still in these early stages. And so working through those groups that are already involved in the pandemic response, in promoting these healthy behaviors, is also going to be really important as well. Thanks.
So Shana, I just wanted to add on to Lisa's comment actually. One very important thing that we are seeing and hearing from countries is the hesitancy among health workers, which Lisa already referred to. As a strategy, most of the time we think of health workers as vaccinators and communicators. We don't take them as the recipient of communication messages and approaches. This time it's going to be very, very important as a strategy that we have a very specific approach to communicate clearly to the health workers. And that may mean like working with the medical associations, the public health association, the nursing association, whoever can influence them. That is going to be very, very important if we are actually to address the vaccine hesitancy, because if they are not convinced, then it's going to be really a problem. The second thing also, as Lisa mentioned, out the whole array of who are the influencers, who can talk to who, and who is going to believe who. That is something that will have to be done very much at the local level. But one thing which has worked, particularly in RCC, is having people who've experienced COVID-19, because the way that COVID-19 has affected families, when they go and talk on whether on mainstream media or in communities or in paper, wherever, that has a very powerful impact. What does COVID do? And that is why the vaccine is going to be so important to get it. And if we can actually combine it with people who've got vaccinated, the hesitancy would be definitely lowered if it's somebody who's trusted in the communities who is getting vaccine, but also to show people that this is the real situation. The real stories of the people from the field has had a really good impact in making people believe that these preventive behaviors are going to be important, and that includes one of them is vaccine, along with all the masks and hand washing and everything that we need to promote.
Wonderful. Thank you so much, Lisa and Deepa, for those fantastic responses. We have just 2 minutes left. And so what I would like to do at this point is actually turn to each of our panelists to provide one last piece of insight and final guidance. We'll start with Tamer, followed by Sid, Deepa, and then we'll conclude with Lisa.
Thanks, and apologies for not being available before, but the questions were answered really well. And, you know, I think what I would kind of end with is that community engagement and trust are really the key ingredient to preparing communities for uptake, demand and uptake of the COVID-19 vaccine. And not just the COVID-19 vaccine, but any vaccine and future new biomedical tool. You know, we're at an unprecedented time when we're being introduced to so many new biomedical tools at once, but this is not going to be the last time that this occurs. And we have to start planning and preparing for, you know, the next pandemic. And I think this opportunity really allows us to reflect on what we've done well, perhaps what we've done not so well. But, you know, this preparedness that we're doing today, it's not a singular opportunity missed. It's really an opportunity missed for creating a foundation for the future of public health emergencies. And so I would say that we really have to consider this, the work that we're doing now is preparing not just for COVID-19 and the eventual, hopefully, end or at least lessening of the transmission of the virus, but really to look at this as a preparation for future emergencies. And I really encourage you know, to look at the role community engagement plays, and that we can really, I hope that we can really advocate through COVID-19 and the work that we've done to date, and show the importance of communities for future responses. Thank you.
Thank you, Tamer. Over to Sid, followed by Deepa, and then Lisa.
Okay, thanks. I think two messages from me. One would be about continuing to promote and intensify COVID appropriate behaviors, because there is a tendency when we talk about vaccination, you know, COVID appropriate behaviors are falling out of the window. And this is our current experience, what's happening, because we have the spike in cases as well as COVID vaccination, even though we are at 48 million vaccinations as of today. The second one, it was actually a response to what, in addition to what Lisa and Deepa mentioned, getting the confidence of the health workers to vaccinate. Our experience has been that we need to have an equal amount of the legislators, of the bureaucrats, of the politicians getting vaccinated at the same time. That builds confidence on the health workers. When we say priority groups, health workers only, what ticks them to go for vaccination? We need to have politicians also vaccinated at the same time, and that's our personal experience. So for countries who are getting into full implementation, that would be my submission. Thank you.
Wonderful. Deepa and then Lisa.
Okay, I think Sid has covered it quite well for health workers. So I was going to talk about it, but I think it's very important to understand the health worker bit. But the ending takeaway for me is it's very important to focus on social listening. What is it that people are actually telling us? What are the fears? What are the concerns? That's why it's very, very important to listen to them. The other end of the story is, what is the science telling us? What is the evidence actually telling us? And then directed by what the evidence is telling us and listening to the communities, we need to have a realistic, practical plan which covers a whole range of communication approaches. And one thing not to forget, which may actually be which may be forgotten, or it may just be a generic strategy, is that there are lots of people in IDPs, the refugee camps, the hard to reach areas, the marginalized communities, where the priority population do exist, but it's likely that people may just it's not forgetting, but they are likely to be missed. So we have to make a conscious efforts to reach to these, and we need to have appropriate communication channels to reach them. The last very important thing I cannot emphasize enough, that crisis communication is going to be very, very important, because there is, every day we hear rumors. It may be associated with vaccine, it may not be associated with vaccine. So we need to be prepared to address the rumors, the concerns, the misinformation through a very well written, not written, but also implemented crisis communication strategy.
Wonderful, thanks. And Lisa, please round us out and close out our seminar.
Thanks so much, Shoshana. Thanks, everyone. So I think, in the closing remarks, a lot of it's already been said, but I will just emphasize that we are in a very, a situation right now that's unprecedented. There's unprecedented attention on vaccination, and much of this is in a very complex situation where we have multiple vaccines, we have different kinds of equity considerations, and we have the potential for kinds of events to take place that could really erode and challenge all of the important progress we're really trying to make to ensure that to support people to seek and accept vaccination. And so really thinking about being absolutely comprehensive in the full range of strategies that we're implementing, working through all of the possible champions and partners and supporters that we can engage with, doing the listening, like Deepa said, which is really, really important. Not assume anything about how people are feeling or what people think about vaccination. And lastly, just to be prepared. There may be a bumpy road ahead. And so as part of these preparations for any kind of risk communications, it's really important not only to have the processes in place, to have trained spokespeople, but also to be thinking about how we would communicate around some of these very complicated issues that could emerge. And this is some of the techniques related to how we communicate in a way that's transparent, that demonstrates empathy and concern and compassion, and also in ways that acknowledge the unknowns. We're still in the early days of the global rollout of these vaccines, and some great progress is already being made. We're seeing so much that the safety of these events, the safety of the vaccines is so well assured, but still it's possible that there could be a bumpy road ahead. So being prepared to be able to respond to these situations and make sure that they're not going to negatively impact all of the hard work that we're doing to build the confidence and trust is really, really important. So that's just a few closing remarks, and to really wish you all of the best in your work ahead, and not to hesitate to turn to all the resources that we're making available, or to follow up with us if you have any questions about those resources and how they're being used. So don't hesitate to engage on those platforms like TechNet to contribute any questions or comments about the work you're doing and those experiences in using these tools. And we're going to be looking out for that so that we can also learn as well from the work that you're doing, and you know, that feeds into our work ahead. So thank you very, very much, everyone. Thanks, Shoshana, as well, for facilitating.
Wonderful, thank you. I will now close this really helpful call with a big thanks to all of our participants, our wonderful ECHO team, our fantastic panelists, and of course, always our interpreters. Many thanks and have a great rest of your day.
Thank you.